Runny nose, low-grade fever, and coughs and colds. These are a few of the typical ailments that send children to the emergency room. But is it always necessary to rush to the ER? We're taking action for you with 5 serious symptoms in children that you should never ignore. 6-year-old Andre suffers from respiratory distress, so trips to the emergency room aren't unusual.
If he's under slight distress and we think he needs medical attention, we'll call the doctor. If it seems to be mid or severe, we don't wait. Immediately goes to the emergency room.
But for many parents, their children's symptoms might not be as obvious. We went to the brand new ER at St. Joe's Children's Hospital to ask experts what the symptoms are that do warrant a trip to the emergency room.
Fevers, particularly a fever in a baby less than 3 or 4 months of age.
Fevers in kids over 4 months of age don't always need urgent care.
If that toddler or that child is running around and there is a temperature of 102, but yet it's got the runny nose, the cold, the congestion, and the child is just being their normal self, then that child can be seen in their pediatrics office the following day. If a fever starts and the child is ill appearing, has any kind of rash that is not a rash that the parents recognize that is worrisome, then that child needs to come to the emergency room.
The second symptom is a bad headache, but how can you tell if a headache is dangerous? The doctor says if it follows a fall or a trauma and the child is vomiting, go to the ER. Also go if it involves a stiff neck.
The whole stiff neck goes with the probability of meningitis.
Next, a widespread rash. Don't be too concerned about a rash on your child's arms or feet, but if the rash is all over the child's body or includes small red or purple non-blanching dots, then it's best to seek emergency care at once. And finally, stomach bugs.
That is one of the most common reasons that they come.
Vomiting and diarrhea can lead to dehydration. The younger the child, the greater the risk. And you can't always call your pediatrician first. They can help determine the severity of the symptoms, but the doctor says parental intuition is usually right on. If you know your child isn't looking or acting right, trust your gut and go to the ER. For more information on when to take your child to the emergency room, head over to my Facebook page. Look for Linda Hurtado, WFTS, under Pages.